Okay, so today I would like to have some update on the digital adherence technology for TB. Okay, so this is my outline for talk for today. So first I would like to show you what is the digital adherence technology or DAS and the type of DAS and evidence-based support, the use of DAS, and finally the implementations of the current use of DAS program. Oh, sorry. So why we need the digital adherence technology? As you may know, that non-adherence for TB drug has a profound impact on the clinical and economical outcome for the TB treatment. But however, the suboptimal adherence for TB treatment is still common. So to reach the WHO TB elimination goal to preventing a non-adherence and the implementation, the cost-effective, the intervention program should be received in the highest priority. However, the conventional DOT or direct observation therapy has been implemented since 1995, but there is some challenging in the current DOT that have been used right now because it's a heavy workload for the healthcare worker in case that there are many patients to receive the DOT, and it's a lot of costs that healthcare worker or patient have to pay if they have to transport to the clinic or at home visit. And DOTS is not all patients require the same level of the monitoring support. This is a Cochrane review for the DOT for treating TB. This includes 5,600 participants over in 11 trials, and the TB cure was low with the self-administration across all studies ranged from 41 to 67%, and DOT did not substantially improve outcome by the risk ratio about 1.08 and 95% CI is about 0.9 to 1.2. This is included in the 5 trials and cover 1,600 participants. So when the conventional DOT doesn't work, so what are the digital adherence technologies or DAS? DAS are the tools that designed to support people with TB taking their medication. On that, and DAS is low. The patient can take the medication at the place and time that they want, but they remain connected to the healthcare provider. And healthcare provider also can identify the high-risk patient who may need additional support for the TB treatment. And I would like to show you some of the data that how digital technology are currently involved in our lifestyle. So this is the data from the National Statistical Office, Thailand. This is a survey of the households on the use of information and communications technology in Thailand in last quarter last year. This survey conducted among 64 million people, Thai people who are older than 6 years old, and they found that 85% or 54 million people use the internet, and 94% or 60.6 million Thai people use cell phone, and 86% of them have their own cell phone. And on the right hand side, they show what type of the cell phone that has been used in Thailand. You can see that 93% use the smartphone, whereas only 7% use the feature phone or ARMA phone. So the left hand side is show the use of the internet was substantially increasing in the recent year. Since 2017, there are about 55% using the internet, but increasing over the year, especially after the 2019, when we have the COVID pandemic, the use of internet was increasing up to 85.3% in last quarter last year. So our lifestyle has been very heavily involved with the digital technology. And for the type of the deaths, according to the WHO guideline for the use of digital technology to support the tuberculosis treatment, there have 3 types of deaths. First is short message service or SMS, and EMM or event monitoring device for medication support or smart pill box, and video support, video observed therapy or BOT. So I will go into detail in each type. So first for the SMS and medication sleep, SMS is an option that standard and built-in function in the all type of cell phone worldwide. Is inexpensive and easy to use for many users. And the medication sleep combine customized packaging and utilize free or low-cost interactions such as a phone call or SMS or other messaging technology to text the SMS to the healthcare provider or to the patient. Many of you may have been heard about the 99 dots. The 99 dots is a low-cost cell phone-based DATs that have been used to monitor more than 150,000 TB patients in Indian government program since 2015. Patient medication is packed in a custom secondary envelope, which add the dose instruction and the series of number behind the pill. So when patient take the pill, and each time patient take a dose of the medication, the hidden number is revealed, and then the patient make a free phone call by the standard feature phone to text the number behind the pills to the healthcare provider. And the system will summarize the adherence of the patient to the healthcare provider for review. Oh, sorry. And next is the event monitoring device or EMM. This is a smart pill box employ the electronic sensor that can provide treatment reminder and log daily dose via the mobile internet connections. The sensor will, when patient open the box, the sensor will send the signal to the system, and then they will collect and stamp time and date that patient opened the box. And this can notify healthcare provider to contact patient when the medication box remain unopened or for a day or more. So the right hand side is the chart that will be, this is summarize the patient dosing. The dot is mean the time that patient opened the box, and the gray and the green line indicate that patient opened the box on time that they should open. So, and the lower bottom, this is a summarize of the adherence. It can summarize that how many percent that patient have a correct dose on time, or how many dose was missing. So, and this is one of the EMM system that has been currently used in clinical trial. For example, the Phoenix study, the preventive therapy for the household TB. In ACTG study, the EverMed 1000 is a tabletop dispenser designed to easily hold a month's supply of the TB in that box. So, and when patient open the box, it will be send the signal to the voice pill system. And this system can send a real-time notification to the either patient mobile or healthcare worker mobile. So the next that is a video observed therapy. The type of VOT is divided into types. The synchronous VOT, like a live video call, for example, like a live call, when you have a live call with your patient, is a synchronous VOT. And another type is asynchronous VOT, which is patient can download the application and take the video clip will be record the video clip and forward into the system, and then the healthcare worker can be reviewed it later. The synchronous VOT is currently used in some clinic in US and a high report level of patient acceptability. Decreased cost compared with conventional DOT and programmatic is evidence of effectiveness. So this is an example of the VOT when patient can download the application to their smartphone, and they show the pill and take the pill and submit the video clip to the system, and the system will upload this to the cloud, and the dot worker can review the clip later and can be have a notification back to patients if they didn't receive any video clip. So I will share you some short clip of the VOT. ช่วยเปิดวิดีโอให้หน่อย Yeah, that's a app that called Adherence. This is the application that's currently used in US. And this is evidence-based for the DAS. This is the first RCT demonstrate the effectiveness of the medication monitor to improve adherence in TB, which was conducted in China. Include about 4,300 TB patients were randomized into a cluster into 4 arms, include the control arm, which is not have a self-administration and text messaging. They get the 2-time SMS per day and medication monitor. This monitor will remind the patient what the time that they have to take the medication, and if the patient didn't open the box, it will be remind again. So the reminder from the medication monitor improved the medication adherence of TB patients, but the SMS text did not do improve the TB adherence. And this is a study that compare between video observational therapy versus a conventional that has been published in Lancet in 2019. This is multi-center analyzed by randomized control superiority trial in 22 clinics in England. They include total of 226 patients divided by received VOT 112 and conventional 114 participants. The primary outcome was successful completion more than 80% of the scheduled treatment observation after 2 months following the randomization. You can see on the right-hand side is in the bar chart, the purple bar represents the VOT and the red bar represents the conventional DOT, and the left-hand side is the table that shows the logistic location of the 2 arms, the control and the intervention, which the VOT have a high odds ratio about 5.2 with a significant statistical significant difference. So this study showed the video observation therapy have higher adherence than conventional dogs. And this is the first large RCT in Africa, include participants about 1,100 use the wireless observed therapy in Africa. This system is kind of is similar to SMS. It consists of ingest sensor, detection pad, and pair with the mobile device. The patient will receive the reminder and motivation message in when they had to take the medication, and the outcome is a treatment failure for the TB. So in the right hand side is a bar that you can see the unsuccessful treatment outcome was lower in the intervention arm, which is about 4.2% compared to the control arm, about 13% with statistical significance. But however, this is the latest study after the COVID-19 that show the 99 dots did not improve the TB outcome in Africa. This is a cluster randomized trial, include adult for drug susceptible pulmonary TB in Uganda. And there was a facility or cluster randomized to compare to control group and the intervention group, which was used the 99 dot based intervention. The outcome is the treatment completion and the treatment successful in the intention to treat arm. You can see that the control arm has about 71% of the treatment complete, compared to the intervention arm is about 73%, and this is not difference. So this is a study that not show benefit in the 99 dots, and from this study, the 99 dots has been criticized about the non-improved TB outcome, because it's required like a patient have to text the number to the healthcare provider after they took their medication. So this require additional work to the patient. So this is why this does not work. And this is a nice review about the digital adherence technology that's just published in International Journal of Tuberculosis and Lung Disease in these years. It shows that from the conventional dot in 1995 and first smartphone available around 2000, and this is the first study, first RCT in China, and followed by the RCT in UK, US. But after the COVID pandemic, you can see the study about that is also decreased. But however, they are expecting that the digital adherence technology will increase after the COVID pandemic. In terms of the implementation, this is a map from WHO handbook of use of digital technology, show the country that has been used the digital technology implementation in their TB program. The purple color is they have the dash in the public sector, and the dark blue is in the private sector. At that time, Thailand haven't any data about that yet. And this is a implementation program called Adherence, which is funded by UNITAID. This project is aimed to help patients success in TB treatment using digital adherence technology. The Adherence project starts from July 2019 and will until the December this year, aim to reach 70,000 patients with TB in Ukraine, Ethiopia, Tanzania, South Africa, and the Philippines. And this project will implement and evaluate three types of digital adherence technology, include medical sleep, smart pill box, and video support treatment. In each procedure, the patient will get the advice from the healthcare worker, and all the procedure will not add the additional cost to the patient. And for the preliminary finding for lung infects in Ethiopia has been present in oral abstract in the Union World Conference of Lung Health last year. And they show that the patient use the smart pill box on their medication dosing history log in platform that help improve their adherence. And the smart pill box combination with different care could be the important approach for TB care in context of COVID-19, where the facility visits are reduced. And this is another implementation program that we call the Global DASH Task Force. This is organized by many stakeholders in many countries. For example, Gate Foundation, United, and Stop TB Partnership. This program help the low resource limited country to implement the DASH into their TB program. And so far, there's more than 100,000 TB patients have been received the DASH on their treatment to support their TB treatment. And they have 29 countries that has been implemented the DASH. So you can see in the figure that now Thailand in one here. Now Thailand is one of the countries that has been used DASH in Global DASH Task Force. So this is all over my summary in the digital adherence technology. So I will stop my presentation here and happy to take any questions.